findings from the ACDC project have been really interesting. Not only have we tested and piloted the proactive outreach project, we found that the level of distress and mental health issues is very wide, varying from different communities across the country. So organisations can really benefit from that proactive outreach approach because it allows them to access people that would really benefit from their particular services, but who they won't connect to unless they've got a proactive outreach approach as part of their service delivery.
They're actually going out there, they're knocking on doors, they're telling people about us, and they're increasing the mental health literacy in our community, which is, absolutely a great thing for us.
So it was a great partnership to work with one of the peak bodies, and I think it's really important to have that collaboration and partnership. They have a lot of expertise in that area, and we wanted to leverage off their resources and support.
In terms of how the community benefited from the ACDC project, it's largely around increasing accessibility and very much about normalising mental health support seeking.
Because a lot of the community did not know themselves about the local services that were provided.
The ACDC project played an important role in reducing the stigma and shame associated with seeking support around mental health services.
It was a good opportunity for us as well to introduce our programs to them.
Hopefully at this point in time the community is a little bit more aware that they can seek support before there is a big explosion of symptoms. It's maybe about getting that early intervention.
Organisations, particularly those working in the mental health sphere, need to move upstream to where people are being pushed into the river, not waiting downstream to pull them out of the river when they're struggling and drowning.
We support delivery partner organisations to really get an understanding of the service landscape in their communities.
We were surprised as an organisation about how many local services there are within Dandenong around supporting people with their health and well-being and their mental health as well.
It improves referral pathways, and also it leads to sector collaboration where services are talking to each other and really improving community outcomes.
Well, one of the organisational benefits of the ACDC project is it's wonderful training for your staff.
Our staff, they feel empowered because they've, through professional development and the training that they got through ACDC, they're now equipped with new skills to support the community. And now post the ACDC project, they're like, wow, I've become a better person because of this project. And we still have that continued partnership, even post the project, which is great. It's still adding value to our organisation.
The project ACDC is funded by the Department of Social Services, part of their ILC, the Information Linkages and Capacity Building Project, which has made it possible to roll this project out right across Australia in regional, rural and metro Australia and every state and territory.
In general, it was quite a positive initiative. I'm hoping that this project can continue in the future.
So I would definitely encourage other organisations to partner with CMHA.
It's ultimately going to help all the services in the local area. It's going to mean that people are more aware of how to seek support appropriately. It's going to mean that there's more connection happening amongst service providers. Ultimately, what that means is that people know more about mental health, there's less stigma in the community, and then they're able to support seek as soon as they are able to identify a concern. And we know that the burden of mental health is very significant, so the longer you leave it unchecked, the more it costs everybody.